Hey everybody, I'm super excited to have my first patient interview. It is with a really good friend of mine, long-term friend, Alex Jolly, who had a very scary incident with a 36, 48 hour change in personality and behavior that ended up prompting this entire series on encephalitis as one of those occult causes of altered mental status, aka change in behavior. And it's really intriguing to me because, I've seen some of these patients with a medical problem who may end up on a psychiatric unit. Luckily, that did not happen to Jolly, and he has done quite well since his incident. But he was interested in coming on and talking about his experience. So I hope you enjoyed the patient perspective. If there's any other patients out there that would like to offer their unique perspective, then it's something I'm certainly willing to do more of moving forward. Hope you enjoy our conversation. Thanks.
Somebody get this guy some help!
Alex Jolly, and for the first time, actually, we are giving a patient perspective on a topic that we're covering. So we are talking about encephalitis, and one of the things that kind of piqued my curiosity or re-piqued my curiosity was the fact that a couple of months ago, Jolly, who I call him Jolly, Jolly had an experience with acute onset of we think viral encephalitis, with a rapid deterioration of his mental state and his level of consciousness, to where you don't really remember a whole lot of it, right?
No, I don't. It came on very quickly. There's like a good 6 hour window of symptoms that popped up, and it pretty much fades to black very quickly. Very quickly, yeah.
So my sister-in-law, my wife's twin sister, texted me and a mutual friend of ours, and was like, "Have you heard from Jolly?" Which, by the way, they live in Denver, Colorado, and we are in Louisville, Kentucky. So that was very strange in and of itself that she was asking if we'd heard from you, and set off a lot of alarm bells.
100%. This is also news to me. I actually never. I mean, we're 2 months down the road here, and those 3 days are still gone. Still gone.
So anyway, she said, I can't get a hold of him. He's supposed to be at home, but the pound just called me, and they said that our dog is at the pound, which set off a lot of red flags because you love Larry.
I do. He's our sweet little Aussie, my little baby boy. So I would never leave him really anywhere. Honestly, he travels with either myself or Carly. Everywhere we go, he's never left alone. So the idea that he would be missing or get a call from anybody, there's something, that's gone very sideways.
My first thought was that you were being held against your will, most likely by the police. If for no other reason that it was just such a abnormal, weird presentation.
Of course.
It was hard to imagine how you would have gotten yourself into that situation on early in a Saturday afternoon.
Friday is when all this started for me.
Friday is when it started, but the text came in on Saturday.
On Saturday.
You may not even remember Saturday at all.
I don't.
Yeah.
No, I don't.
So Saturday, because Sax and I were playing in a golf tournament, and we played our whole day, and then we both saw that we had texts from Carly, like, "Have you talked to Jolly? Where is he? What's going on?" And it's like, I don't know. I don't know how many miles away it is, but many miles away.
1,500 miles away? Yeah.
But the story that I got was that, I'm asking about, well, what's going on before all this? And after my step-sister-in-law, who lives in the same apartment complex as you, after she went to check on you, she was like, yeah, he's okay. Like, he's not hurt, but there's something off about him. And so I'm like, well, does he look like he's intoxicated on something? She's like, no, but he just like is really nonchalant about everything. I told him about Larry, and he was like, okay, go away. I'm sleeping. And it just wasn't making a whole, you didn't understand the gravity of the situation and how worried everybody was. But then I started asking, well, what's been going on the days before? And the first report I get is, well, he hadn't slept in 3 nights. And he's been extremely anxious. And of course, the psychiatrist is thinking, okay, 35 years old, kind of late for your first manic break.
Right.
But there's some elements that match up with that. You got no insight. And actually, when people are full blown 100% manic, and there are levels to mania, but the way that I describe it to patients is the light bulb of consciousness turns off.
Completely.
And people who have full-blown manic episodes they won't remember the things that happened or what they did after the fact.
Sure.
So that was like, because you were so resistant to getting any help and you had no insight, and they gave me that piece about not sleeping, I was like, okay, maybe that's what's going on.
Right.
But anyway, it was like, hey, we got to get him to the hospital.
Yeah.
And you were very resistant to that.
Highly resistant to the hospital. This is also, so unfortunately, goes back to my demeanor in general of like, I'm not one to ask for help. So even being tapped out subconsciously, I'm going to tell you everything's fine and leave me alone.
Yeah.
Is exactly what I'm going to do. So that stage of stepsister finding me, talking to me, I have zero recollection of that. For me, my lights faded or turned almost completely out on that Friday before anyone else.
Yeah.
On there. Like, I might have been talking, but I have no memory of Friday at all.
So what is the last thing that you do remember?
Well, so not Friday evening, I should say. So my memory on what happened to me was I got off on work on Friday. Typically the dog goes to the shop with Carly where she works, and I'll pick him up when I get off work. I'll take him to the dog park. So I drive there after work, 3, 4 o'clock in the afternoon, grab him, take him to the dog park. When I got over to see Carly, I pointed out that I had it's a rash. It looks like some sort of allergic reaction happening on both my hands. It's like little pimples that just broke out on my hands. So I pointed that out to her. That was weird. Backstory on me is I'm in construction, so it's very likely that I picked up insulation, some fiberglass got in there. I get cuts, whatever. So I didn't think much of it. I pick him up, take him to the dog park. Around that time...
This is Friday, right? Friday morning.
Yeah, Friday morning. I pick him up and go to the dog park. Second symptom shows up then, and it's my skin. All of it, head to toe, is pins and needles to the touch. Like, everything hurt. Picking up the ball to throw with him, that felt like pins and needles. Petting him felt like pins and needles. Getting back in the car to drive back to the apartment, sitting in the car seat, pins and needles on my back. But from getting in the car with him to drive back is when my lights start fading out. So I don't remember the drive back to my apartment.
I wonder if you ever made it back into the apartment with Larry.
I never did.
Okay, so you just made it into the stairwell.
Correct.
And then you, on autopilot, went back to your apartment.
Correct.
Which, by the way, is really interesting that even in an unconscious state,
yeah,
you knew how to get...
Yes.
Your homing devices were still operating. You knew how to get back home.
Yeah.
Right? And then it sounds like at that point you were feeling pretty bad, even though you didn't feel it.
Right.
But you were feeling pretty bad and tired and
completely
laid down. And I guess you really slept pretty much
24 hours, 12 hours.
It must have been, because again, this is all before I was aware of anything.
Completely.
Before anybody else, even Carly, right? Yeah. So I guess maybe she worked late.
So I think she worked late, and she'll have to give a test to this, because we've talked about it, but we've talked about bits and pieces. I've pieced together some from my brother, Carly's stepsister, all of those. the other side of this too is I haven't pieced all of it together because it's pretty rough to hear. For my side of like, she's like, "Do you want to know what happened?" And I kind of like, I just don't. I want to get through this and figure out and move forward.
Yeah.
So I haven't pieced my own full story. She can piece a lot, but I haven't pieced my own.
Well, let me know if you don't want me to piece something
No, please,
together.
please.
but-
You can piece it together. It was more so, very early on with this happening. I didn't want to know because it was just like, it's just scary.
Yeah.
Honestly, you turn your, to me, I woke up on Monday. Like,
Right.
I got off work Friday, and the next thing I knew is I came to Monday and looked at my phone with calls from work of everyone worrying about me, and that's, to me, it was a weekend, so I didn't
Right.
know what anyone
And
wanted.
you're like, why is everybody at work bothering me on a Saturday?
On a Saturday afternoon, like, leave me alone. It's
Yeah.
nice out.
Yeah.
Yeah.
So anyway, the situation escalated, but you were so resistant, and obviously
Completely.
your behavior was the lights were out, and I didn't know why because
Sure.
between Saturday and Sunday, I mean, I'm going crazy over here trying to figure out from afar like what could be going on with you,
Of course.
and trying to emphasize the need to get to treatment, but also realizing if this was a psychiatric issue and somebody came to pick you up, they can't force you into the ambulance
Completely.
without you being in a completely altered state. And I didn't know
Sure.
if you would come off like that to somebody.
So it's interesting you say that. So of my bits and pieces that I come to, the best way I can equate this is, and maybe some of the listeners don't have this, but it's like when you get blacked out drunk, and it'd be the equivalent of you get blacked out drunk, you don't know what happens, you got food somehow, you made it to your own bed. In that state, you kind of have a, if you're drinking, we call it a brownout, where you come to for little bits of pieces. It was that. So I think that time frame leading up to it, I guarantee I was beyond resistant to anyone helping me. It was just leave me alone, because that's very much who I am. I'm just like, I'm fine. It's that. So whether you can believe it, also sarcastic, which doesn't help
Yeah.
in the slightest if someone's actually trying to help you because something is wrong. But yeah, I guarantee I was resistant. But I do know when the ambulance did come and the EMT got there, that when they came in, that they woke me up, because I woke up to, I don't know, nine people with flashlights shining on me. I remember that. I remember waking up. I remember putting clothes on, and then them saying, asking the question of how many drugs have you done? What drugs have you done? And you need to come to the hospital. And I remember basically, like on cruise control, got up, put shorts on, sat in the bed, and got in the ambulance with them. That being said, in the ambulance, the last thing I remember is freaking out in there, and then them strapping me in, and then it fades to black again.
Yeah.
Yeah.
Yeah. And again, the situation escalated when, from my understanding, Maddie, stepsister-in-law, went over there, was like, something's not right, but it doesn't seem like anything is like immediately acutely dangerous, like you were dying or anything.
Right.
I told her to like check your vitals, at least your heart rate, and make sure you're breathing at a normal rate, which, yes, rules out certain like intoxications. But she was just like, clearly something's not right. And then your brother came over.
Right.
And again, just the nonchalantness about the situation was the most concerning thing. And I think at one point you were walking around your apartment without your clothes on.
100%.
And that was like, okay, this is not jolly behavior at all.
Not in
like,
the slightest. The little brother was very upset by that one.
Yeah.
Yeah.
Yeah. I could see you isolating in like a moment for like maybe half an hour, but then kind of popping your head back out. But like that was just locking yourself in the closet.
Don't remember that.
Yeah. They were trying to get you to go to the hospital, and you were like, I'm not going. And you locked yourself in your closet. Again, just resistant and not understanding what was going on. But shortly after that, they did get you to the hospital. And when you came out of the little window of lucidity there,
Yeah.
apparently they had to strap you to.
Yes.
They had to use physical restraints.
Yes.
And so here is the aspect that one of the reasons why it piques my curiosity professionally with what I do, because I've seen this before, and it is a prime example of a way that somebody can not get the treatment that they need
Sure.
and end up just being shuffled into the psychiatric unit.
Yeah. Yeah.
Because you did not have these obvious signs of something medically going wrong.
Sure.
To the untrained eye, it was just primarily behavioral changes, but like such drastic behavioral changes in such an acute time frame that would tell me that something had to be going on. But it's so lucky. Like, I am so glad that you got the workup that you did when you got to the hospital.
Yeah.
And you got like a full neuro workup. You got a lumbar puncture within hours.
Yep.
They couldn't do an MRI because you were,
I woke up in that one.
yeah, that was later, but you were thrashing all about.
Yep.
And they knew they wouldn't get a good one. They should have put you down with some Ativan or benzo, but
I remember asking the guy when I was in there, because I can't. That's a weird place to
come to.
come to. Is
Yeah.
in a tube.
Yeah.
Not cool. I remember asking him if I was fine, and he was like, "Yeah, you were just kind of out laying there," and then he was like, full on panic set in, and I was like, "Yeah, because now I'm talking to you,
Right.
like you can tell that I'm there now." But that was a very quick stint, and it was back out again.
It's like the voice of God in the MRI machine. You're
Right.
like, where is this voice coming from?
Yeah, maybe the magnets pulled it out of me.
Yeah. But you got a full workup. It didn't. They didn't find much. They
Right.
didn't find anything specific. Your EEG, the thing where you put a bunch of the little stickies on your head that
Ooh.
measures your electrical activity in your brain.
I believe I was very resistant to that one.
It showed that there was some abnormal brain activity, but it didn't specify exactly what was going on.
Sure.
And so they did, what's called a broad spectrum treatment. They started you on antibiotics in case it was bacterial. They started you on the only antiviral that has any real effect in encephalitis, which is against the family of viruses called
Right.
herpes viruses,
Right.
which again are also typically associated with behavioral changes, which we still don't know why that virus, which lives in our spinal cord, we don't know why it migrates
Right.
instead of the normal route out to the skin into the brain.
Yeah.
But you got started on that stuff. You were also started on anti-seizure medicine in case you were having some odd form of seizure activity.
Right.
And within 24 hours, maybe even a little bit less than that, you were coming back too. So tell me about what it was like to come back.
Coming back was really weird, because it was I came to consciously to where I kind of stayed conscious, and I was actually coming back. It's very odd, because I don't know how I ended up in the hospital. I don't know what my mom was doing in there reading a book. When I came back into it was just my mom in there, which Carly can tell you this as well. And it shows that my brother and parents both know how hard-headed I am to go against that. Is I woke up super congested and couldn't breathe, and basically told my mom I need to get out of here, which she allowed me to leave. To where I think Carly spoke with her afterwards and said, and her response was, "He's 35. I can't stop him," which is a fair response. With she raised me. She's seen enough of my nonsense to allow me to do that. But I did leave. I did walk outside. I did try to rent a scooter. I tried to rent a Lime or a Bird scooter. I had my phone with me. It wouldn't open. Tried to ride it anyways. And if you know anything about the Bird or Lime scooters that are laying all over cities, they don't unlock unless you unlock them. I tried to give it a go, fell over the handlebars, left it on the ground, walked right back into the hospital. Pretended
Nice.
like nothing happened.
Nice.
But coming back to was wild. I mean, it was besides that congestion moment, it was just kind of like you're waking up and trying to put a puzzle piece back together. It's my best way to say it is like you get blacked out one night and you're like, I don't understand how I ended up here. It's exactly like that. This just so happens
Except
to be
being 2.5 days later.
72 hours later
Yeah.
or whatever it is, which is even crazier. But yeah, it was wild. I came to with multiple IVs in my arm, and EKG, whatever, on my chest.
Yeah.
Immediately went to rip those off. Don't advise that. Those do not feel good to rip off.
Especially if you have chest hair.
Especially if you have chest hair, because I was patchy for a minute. But yeah, it was it was just interesting because I had no recollection of what just happened and how much time had passed. And
Yeah.
Yeah.
And so you got to the hospital, I believe it was early Sunday morning / Saturday night, sometime in that
sure,
window of Saturday night to Sunday morning. And the city of Louisville was on pins and needles,
I believe so.
just waiting to hear what was going on because, you were 48 hours from being your normal self.
Right.
And then, I was low-key freaking out about it because you're one of my best friends.
Yep.
You're probably going to be my brother one day.
Probably related at some point.
And and me having the professional training and experience knew how severe this was.
Right.
And how serious it
I
can
wish you
be
would have
in
told
terms
my
of
brother that.
in terms of yeah, well, I didn't know what the hell was going on at that point.
Right.
But even, if you were manic, that's what I was saying. I don't know if he's manic. They wouldn't. I didn't even have a video of you. Like, I was trying to get more information, but I was like,
Yeah.
either way, it's a very dangerous state to be in.
Right.
Because as the similarity there is that you're operating based on impulse.
Completely.
The animal brain, the animal mind is doing its thing, and the human part of us, our frontal lobe, which says, no, maybe I shouldn't say or do that,
Right.
was not functioning.
No. Zero chance that was functioning.
Yeah. So it was such a relief to talk to you on pretty early on Monday, and you, one of the first things you said is,
I don't remember talking to you, to be honest with you.
yeah, on Monday.
No, I don't.
So I knew that you had come back. I'm
Yeah.
sure you talked to so many people
That too.
and were in and out of sleep and getting used to being on Kepra, like
Yeah, trying to ride scooters, all sorts of things.
right.
Yeah.
But one of the first things that you said to me, classic Jolly fashion, was you were like, so what are we doing for this bachelor party? our other future brother-in-law is getting married actually later this week. And so we were both planning on going on
Right.
the bachelor party.
Yep.
So that told me that you remembered and like you were back to your sarcastic,
still there.
normal self.
Yes.
But
Yes.
you knew that you were in the hospital. You knew why you were there.
Right.
Obviously, you were confused, and it was a total mind fuck.
Oh, for sure. Because I think at that point of talking to you, because I don't remember that conversation, but I guarantee I came to him was like, I had no understanding that 3 days had passed.
Yeah,
Had zero understanding of that. I just assumed it was the next day,
right.
and we would continue with our plans as usual.
So looking back, had there been other signs or symptoms that maybe were related to that? Did you have any insomnia, or was your anxiety worse?
No, the anxiety hasn't been bad.
I mean, before.
Yeah. Leading up to this whole thing, anxiety wasn't bad. No, really at all. I was just in motion of changing into a new job, but no anxiety there. I'm pretty excited about that one. And then as far as insomnia goes, I wouldn't necessarily say insomnia, but the biggest thing that I've battled for the last few years is lack of sleep. It's due to having a deviated septum. I broke my nose when I was a younger kid. I don't sleep very well. It also doesn't help that, started using Afrin, which, takes away any congestion in there. Oddly enough, no one tells you that stuff's comically addictive, And when you start it, use it for a week or so, basically you have to continue on. I never thought twice, I just continued on. So a lot of times I wake up 3, 4, 5 in the morning or something like that, fully congested. You have to take that just to open up your airways, just to get back to sleep.
Yeah.
So I wouldn't necessarily say insomnia, but that is a massive detriment to getting into your REM cycle and actual sleep.
Yeah.
Yeah.
So essentially, like, you maybe deal with some what's called like mechanical sleep apnea.
Yes.
Related to a functional physical deformity in your nasal cavity that.
Unfortunately, so both sides are shaped like a snake.
From the friend and family perspective, I think that you have a much greater appreciation when something like this happens.
Completely.
For how much you love and care about that person.
Yeah.
Not to get all sappy with you,
No,
but
please.
But I mean, I think everyone, there was a bunch of us playing in a golf tournament here on Sunday.
Yeah.
And I can't speak to how others were feeling, but I'd been up most of the night, like, trying to figure out what the hell could be going on with you,
Right.
and just going down fucking rabbit holes.
Yeah.
On my phone, and then Sunday, I was out on the golf course, not at all into playing golf. Like, I'm checking my phone between every shot and trying to get updates.
That's devastating to hear, but I very much appreciate it.
Yeah. It was such a relief to talk to you and for you to have that rapid response.
Right.
Which to me kind of lifts up that it was probably viral in nature.
Right.
What has it been like fucking emotionally having gone through that? Like, it's a life-changing experience.
Yeah, when you go through it that first week out, I didn't think too much of it because I'm trying to figure out internally what happened with no knowledge of really what just happened to me. But it takes a few days to realize that you lost a few days. And then knowing that there was something in there with friends trying to help that maybe if I didn't have friends or if they were out of town or something else was going on, I don't know if I would be here. So I'm super lucky to have them find me, to get through it all, to be okay. So it gives you a much deeper appreciation of life in general, because it's not like this was doing something extreme and you had an accident or something that you're in control of and an accident happens. This just happened out of nowhere. There was nothing that I know of that led up to it. The symptoms that I saw early on, I never would have guessed would have ended me in a hospital. It was never even something I weighed on. It just thought it was like, might be tired, could be this or that. But yeah, to go down and wake up 3 days later, it gives you a whole different perspective of how quickly life and everything can change on you. Yeah.
And I mean, I knew, and I kept this one close to the vest, that it carried a somewhere between a like 5 to 20% mortality rate.
Perfect.
With these infections. And
right.
So again, that, when you take into account your age and the specifics about how long you were out, the risk probably wasn't that high with you. But in general, knowing that, it's like,
that gives me another perspective on this. Yeah, it's crazy.
Right. And so you actually ended up going home on Tuesday afternoon.
Yep.
Because as you kept getting the antiviral and the anti-seizure medicine, you got better and better. They stopped the antibiotics, right? Or did you take them? You took them for 2 weeks or a week and a half?
Yeah, I stayed on the antibiotics for, I want to say 20 days.
Vancomycin and...
Yeah. That was the only one.
Unison? Yeah.
I'd
Broad
have to look at
spectrum,
it.
covering every type of bacteria that they can.
Right.
But you went home on Tuesday.
Yep.
So you would think that with how great our healthcare system is, that when you have a condition that carries a 5 to 15 or 20% mortality rate,
right,
that you would be maybe even be kept in the hospital on Tuesday.
Sure.
Probably should have been kept in the hospital and gotten an actual MRI that showed whether or not there was any obvious
Yeah.
damage to those lobes or those parts of your brain.
Yeah.
But no, you went home on Tuesday, and then tell me about trying to get a follow-up and how that impacted
good
you
Lord.
emotionally and anxiety-wise.
Anxiety-wise, off the charts. Emotional, I'm a bit a touch on the numb side to it.
Yeah.
Not much emotion, but anxiety, though.
Not expressed emotion.
Yeah, not expressed emotion.
I think you feel the emotion, but
Sure.
you just don't express it.
Yeah, yeah,
You know,
yeah.
like
Yeah, no, that too.
I'm similar. I'm similar in
Sure.
some ways.
Yeah, so it was really interesting. It's been I think the hardest part in this is that at the time I didn't have a primary care doctor. I've gone through other medical stuff, surgery wise, being out there, but I've never had a primary care doctor. I don't know if that's a stubbornness, whatever it is. So, I got out of the hospital. I had the viral meds and then my anti-seizure medication that I was on. And then they release you with a packet of instructions on, finish your antiviral meds. Once that's out, you're good. No need for this. Here's your seizure medication, which the seizure medication was a 30-day supply with a half refill, so 45-day supply. But no real instructions on if 45 days was stop taking it or not. So, I get out of the hospital, 30 days go by, I take all my meds, I go get the refill. At that time is when I realized that I only had 15 more days of it. I never really thought too much of it. That being said, I'm also recovering from a brain injury, so there's not a ton of thought going on throughout my days. My day is it kind of still is now, but it was very day to day. It's like, take my meds in the morning, take my meds in the evening, hydrate, eat right, sleep. That's kind of all I'm really doing this first month. It wasn't until about a month in that I reached back out to the hospital multiple times, trying to get in touch with somebody. Absolute struggle to speak with the doctor that was my primary care while I was in there. Never got to speak with him. Spoke with a physician's assistant once. Asked them for more instruction on it, and their instruction was essentially, we can't do anything else. You need to talk with your primary care, which turned into an absolute scramble to find somebody.
Did you tell them you don't have a primary care?
I did tell them that they were like, well, there's plenty of options out there. It was a pretty blanket statement, and basically the equivalent of millennials just saying, just Google it. It was that kind of an answer.
Yeah.
Which I'm not going to say anything bad about Denver Health being in there, because honestly they were great. The nurses were great, but post-treatment, any instructions afterwards is just kind of left you in the dust, and you have to figure it out on your own. I got lucky enough that I found my now primary care doctor, who's awesome, took me in, and he's also a doctor that's no insurance. It's all out of pocket. But I went with him because when I spoke with him the first time, he's very much on the mindset of, I'm going to spend time with you when you book an appointment. So I went with him. First time I met with him via telehealth. It was an hour and 45 minutes call. That call alone was enough for me to be like, you're my primary care. You're everything I needed. I went in and saw him 3 days after that telehealth call, because he got me in super quick. Saw him, did a full checkout. He spent an additional hour and a half with me. It was a morning appointment. I was also late for that appointment. Called him. I mean, he didn't even flinch at it. He took me right in, no issues. Walked me through everything he had received from the hospitals, which was a nightmare to get that paperwork sent over to him.
Oh, yeah.
I would have to check on with them now if they even sent it to him, but they
have to protect your health information, right?
Right.
Even if it kills you.
Even if it kills me, and they have to protect it from another doctor, which I find beyond fascinating.
It's great. You know, they used
So-
to just keep the medical records on the ground floor of the hospital, and anybody could go and
Right.
look. Medical students could look through them, and
Of course.
you know, your family could look through them.
Of course. But sending it via email is that's wildly problematic.
Yeah.
So honestly, I gave him my medical records via my chart login. So like mychart.com, but my personal login. I was on the phone with him.
That's wild.
Yeah, I was on the phone with him. I gave him my ID, my password. Password, then, you know, they text me for your 2-step verification. I was on the phone with him. I gave it to him via the phone. That's how he got all my information.
I can't tell you how many patients I've been like, do you have the labs on your phone with you right now?
Right.
Let's look at them
Right.
sitting right here, or else this
That was
may
it.
never happen.
And, you know, that phone call of 60 seconds for him to get access just for me to log him in on my account, because for some reason they wouldn't allow him to even set up an account on my chart, because he wasn't an in-network doctor, which is even crazier to me.
Jimothy.
Yeah, completely. Yeah, so I logged him in. He went through it. You know, that 3-day time period, 4-day time period between the first time I talked with him and actually seeing him in person, he spent that entire time. He went through every single bit of my records, all my blood work, all the MRIs, the EK, everything. So I sat down with him and he went through it based on the abnormalities he saw on the EEG scan. He was like, you do need to stay on your seizure medication in the meantime until we can get you in for neurology. The neurology appointment is a whole different animal.
Yeah, how
Which
did that go?
I know that was the original question, so I'm sorry for the roundabout
No,
way of
no,
getting there. But that just felt like that's the backstory of all the nonsense. So neurology has been an absolute nightmare to get in touch with. Now, I'm on the outside looking in. I'm not in the medical field. It's a very specialized field of medicine. Can't imagine a lot of people being in it. That being said, from time of my release to my appointment is roughly 105 days was my first opening.
And if you didn't go out on your own and seek out a primary care,
Right.
then you would have to run the risk of stopping your Keppra
Correct.
and just seeing what happens.
Correct.
Right?
Correct. Yeah. I would have 100% had to stop because I would have no way to access it
Yeah.
unless I would go back into the hospital and explain to them what happened. But even then, I don't know if they would be like, oh, sure, we'll just write you a new prescription because I called and asked for that same thing. And
Yeah.
No.
And I had 3 different connections to Denver. Somebody I trained with in psychiatry is out there. Somebody else in anesthesia, and then a medical student that I worked with, who I've known personally for a long time, did actually neurologic research out there before he went to medical school, and struck out
Yeah.
left and right.
Complete strikeout on that. And then what's a doctor that does readings for MRI readings or EEG readings?
Oh yeah, because we were talking about just seeing if we could get an MRI and privately, and then have a radiologist read it.
We had that route, and then I went another route with 2 of my other friends out there. One of which is fantastic. He literally called in all his, I'm calling them country club favors because that's how he knows all these guys, to one of the top radiologists in Denver. And I had one other favor for a neurology appointment, but that busted. They were also 3-4 months out. But I had the radiologist, friend of a friend. He called me. He reached out. He did give me some good advice that like time is your best friend here for healing, and you should be okay. In the meantime, my primary care said the same as well. But he got me on a cancellation list for one of the top neurologists in Denver. But that cancellation list that I got on, that was 6 weeks ago now, and I haven't heard a peep from him. I followed up with him for 2 weeks almost daily to try to get an appointment, and see if there are any cancellations, saying I'm available, and nothing.
Yeah.
Absolutely nothing.
Yeah, that's just crazy.
Yeah.
Yeah, I don't know what else to say about it. What's your primary care doc's name?
Michael Benoit.
Michael Benoit. Shout out to Michael Benoit, who
He's the
was aware of lithium's anti-herpesvirus effect.
Yeah.
Or its ability to inhibit the herpes virus from replicating.
Yeah.
Which I was astounded by, because
Who knew?
I would say there's probably 1 to 5% of primary care docs that are aware of that.
Yeah, he's a good one. He's very I don't want to call him a holistic type doctor, but much more that route of the idea of if you want vitamin C, there's no reason to take vitamin C as a supplement. You should just eat an orange.
Right.
He subscribes to that ideology and thought process. Yeah, so for something as serious as like a brain injury, he felt like a really, not being a neurologist, just being primary care, that holistic approach on vitamins and intake feels like such a good way to go about the healing process after this whole thing happened.
Yeah. He seems like he at least tries to practice the way that I do. He's not anti-medicine by any means.
Not at all.
And understands the benefit, but he also recognizes...
Not at all. He wrote my Kepper prescription.
Right. But he also recognizes how the system operates.
Correct.
And that it's very easy to get into an over-treatment, over-medication
Correct.
Place with so many different patients.
Sure.
So I'm very glad that you found him.
Same.
So, yeah, I mean, essentially, like, you're kind of still in a little bit of limbo. Like, there's not an obvious answer. Now, I will say there are 2 other factors we haven't discussed that I'm by no means an expert in this. I mean, I know about it. I have read about it. I've seen it a couple of times. I don't know it inside and out, and there's probably a lot of nuance that I don't appreciate about it. But there were 2 other things that to go with when you were talking about feeling like you had pins and needles everywhere.
Yeah.
And you experienced that. But then also, I was told that you said multiple times when you were in your blackout state that your skin was burning.
I have no recollection, but it doesn't surprise me knowing how I felt prior to like the heavy symptoms setting in.
Yeah.
Of being on pins and needles. Yeah.
And then, interestingly, Tuesday afternoon...
It also explains why I was walking around my apartment like that.
Yeah.
Yeah.
Yeah. That does make sense.
That does make sense. Just
because you didn't care about social norms.
Not in the slightest.
You just cared about getting your needs met.
That was it. Which,
it's a very childlike state. It goes back to, like, the basic necessities.
Yes.
How do I keep breathing? If I've got to eat and drink, and
if I'm hot, how do I get cool? If I'm
exactly
so on and so forth. Yeah,
exactly. Yeah. But the other thing, when you came home Tuesday, and it was so wild because I'm reading all these case reports on different forms of encephalitis, and I really kind of had a very strong suspicion that it was a herpes virus because you had the rapid response. And because you never had a fever like you would tend to get with a bacterial cause.
Right.
And you would probably have more symptoms with a bacterial cause, more brain swelling. So when you got home, I literally had just read a case report on shingles, or the varicella zoster virus, which is in the herpes family. I don't know why it's not called herpes simplex, whatever.
Sure.
But it was a case where a woman had broken out in a rash kind of in the middle of treatment or after treatment, and it was on her neck in a dermatomal, or in the, there's nerves that correspond to different parts of your skin.
Interesting.
And so with the shingles rash, it lives once you get chickenpox, the virus goes back into the spinal cord like other herpes viruses.
Yeah.
And then it will break out at some point again if there is any thing that is affecting your immune system. So if you get your immune system knocked out acutely, temporarily, or from some chronic cause, then you can have reactivation of that most typical in older people to have the reactivation. But you get this dermatomal rash, and it's very, very painful. But what you had that night, somebody was like, "Oh yeah, he had some rash on his neck," and I was like, "Does it hurt?" And like, "No, it doesn't hurt. It's just popped up." I'm like, "Show it to me." It looked almost identical to
Perfect.
the case report
Of course.
in the C3 dermatome, and I'm
Yeah.
like, "Okay." And since I've talked to some other people, they said it's not for sure. Sometimes you can have the of semi-reactivation, which it wasn't a real reactivation because you
Yeah.
didn't have any pain. It's usually a very painful condition. But it makes me wonder, putting those factors together, the skin burning all over, is it related to the varicella zoster or not, and the rapid response to
What a question.
ganciclovir, the antiviral? Anyway, all of that just to say you're still in a little bit of limbo.
A little bit of limbo.
It would be nice to have every answer
Of course.
and have everything tied up. That rarely happens in medicine. But where are you at now with that limbo compared to where you were in the first couple of weeks?
The best way for me to describe it is just like it's just a car with a tank of gas, and I just hit emptier earlier than I typically have. So my first week out, it was like you got 24 hours in a day. I've got a good 2-hour window where I felt normal. Middle of the afternoon, 12 to 2, and I just felt normal. Then it's a crash. Ever since that first week, I've progressed. I'm just calling it hour by hour. Where I feel back to normal, back to energy levels, has progressively gotten bigger. So I feel great as far as progressing on that front. It still leaves me in a weird limbo of like, I see I see my neurologist on September 13th. I don't know necessarily what's going to happen then. Am I going to stay on the meds? I don't know. Is this a forever thing? Is this a one-time thing? If I have to get another EEG or MRI, what's that going to show?
Yeah.
So it's a touch scary on that front, but from a, I don't know, from my life moving forward perspective, I feel good. I feel like things are moving in the right direction, and I can head back to full normalcy, here.
Yeah.
Here
It's
shortly.
kind of like a double-edged sword. I mean, on one end, you don't know exactly what happened, and,
Sure.
and you may not have that answer. But on the other end, I would imagine just, not, I guess, fully experiencing it
Yeah.
consciously, but just knowing that you had a brush with death.
Yeah.
What does that feel like?
It's kind of like I said earlier in the episode of and some of the things that you brought up that I didn't know happens, like walking around my apartment with my skin on fire.
Yeah.
News to me. And I don't know if this is the healthiest way to go about it, but it's kind of something that I've pushed onto a back burner or tried not to think about at all. It's one of my personal ways of coping with serious things like that. Typically, it comes out as sarcasm, as ignoring it or whatever. So
Yeah.
I haven't thought a ton about it. I'm very grateful for where I am now, but I haven't spent a lot of time looking back going, besides being home now and bumping into other people and being like, yeah, I almost died 2 months ago.
Yeah.
Excluding that, which when I say that, it does come out sarcastically,
Yeah.
which is my internal coping mechanism there. I don't think about it a ton. I'm trying to keep it glass half full and move forward and be positive.
Yeah.
I think there's something to a positive mindset, helps internally somehow on a health reason.
It's a positive defense mechanism to suppress some things
Yes.
when you just don't have the information.
Right.
Right. And
that too.
I mean, you're kind of in that limbo state. You're waiting, and it's like, okay, I'll put that out.
yeah.
But what about the fact that, yeah, you could have died and you didn't? Does that have you had any kind of like positive spin off of that idea? Like if you got into a huge car accident and came away unscathed, you might, really have a new lease on life.
Sure. I can't say for sure. You're the first person to ask me that in the last 2 months since this has happened.
Well, Well, we got to find some positive because our minds love to just focus on the problem and all the negatives,
Yeah,
right?
yeah. No, there certainly is positives, but it's not something that I'm like. I'm trying to keep my day by day half full and not so much dwell on what happened 2 months ago.
Yeah.
Not that I'm trying to completely forget it and suppress it out of my memory, even though it was pretty suppressed for on its own for 72
Yeah.
hours.
Yeah.
I'm not trying to do that, but I just there's something in my psyche that is focusing on today's positives and moving them forward into tomorrow. That keeps me driven to where I don't know what's going to happen in a month seeing neurology. I don't know what's going to happen in a year, but
maybe the
not
better,
dwelling on
maybe
that.
the more obvious benefit or
Sure.
positive behind the experience is, do you worry as much about things that maybe you worried about before that just don't seem that important now?
Yeah, quite a bit because life can disappear very, very quickly when you're not doing anything but, honestly, just walking around and have something like this happen. Yeah, it gives you a completely different outlook that, life's precious, it's short, and, we're a touch out of control as well, which is... It's tough to accept. Maybe that's what I'm trying to get at, that I'm I have a lot of acceptance in that.
Yeah.
Because I didn't have any control over what happened to me at all.
Yeah. And this is not the same experience. I didn't experience it directly, but when my brother died suddenly, unexpectedly, of a cardiac condition, there were panic attacks. There were, especially because it was a potentially genetic familial thing.
Sure.
And again, because of what I did, I knew that the genetics were kind of 50-50 of whether or not I would be affected.
Yeah.
If it was a genetic cause of the cardiac condition.
Sure.
And it was pretty miserable for a while, but then there was something that I distinctly remember, like, hey, I'm here and I might not be here in the future. Like, I better fucking go live my life.
Yeah.
Right. And not get caught up in all the bullshit that
Right.
we can tend to get caught up in.
No, I haven't taken a step back to look at it that way because obviously I knew you and we were very close back then too when that happened for you. But I personally haven't had family members or anyone super close to me. I guess there's some friends in there. But typically I've kind of had that still look at death that it happens with old age and that's the end of the story. So I haven't taken the step back to look at it of, it's more how it affects others. And if it did happen to someone else, maybe it's a touch selfish of me at the moment, but
most of our thoughts are about ourselves.
true.
Most of our emotions are about,
Yeah.
perceptions about ourselves or what other people are doing and how it relates to us.
Yeah, it's I don't know. I'm living a very very kind of a narrow mindset, and I don't want to call it selfish because like I do care about the people around me and surroundings and stuff, but it's more that my life right now is very day to day, and my only way to get through it and get to the next thing is half full. That's it. We'll see what happens with the next thing and continue on from there.
Yeah.
Yeah.
And I mean, it really is like you and I have talked a little bit about ACT and actually we talked about relational frame theory. I don't know if you remember the chimpanzee and the baby.
It depends on when you talk to me about this.
It was at that when we were getting breakfast when we were out in the mountains.
Oh, yes.
Remember, it was a really
yeah.
good conversation.
Oh, yeah.
But we
Yeah,
talked
yeah.
about the A, B, C, D phenomenon.
Yeah.
With babies and chimps and
Yes.
how both babies and chimps recognize a reward when it's given when I pick one choice.
Of course.
Based on something that's shown to me.
Right.
So the option is an A or a B is shown on a screen. When the B is shown, if the chimpanzee or in a separate room. The 1-year-old
Right.
picks C over D, they'll get a reward.
Right.
And it trains the person. It's a direct contingency. It trains them to, when B is shown, pick C, and the baby and the chimp are no different there. But the major difference in how our minds work or how our brains work is when you flip that and you show the C or the D on the screen without any additional training, and then you give them the options of picking between A and B. When C is shown on the screen, the chimpanzee does not make any connection or relation between C and B. But the human mind makes this automatic or unconscious recognition that when C is shown, if I pick B, I'm more likely to be rewarded, and almost always picks B, whereas the chimpanzee is like 50-50.
Right.
So it is this ability of our minds to relate things together, which is part of the reason why we're all dealing with way too much information
Significantly too
and minds that are able to generate so many different relationships and possibilities.
much.
And our mind is like an animal's. It's focused on survival and
Right.
identifying not just problems, but potential problems.
Yeah. Right.
So if I watch a video of somebody being involved in a road rage incident, yeah, it seems benign enough with me watching it. But then later when I'm out driving, I may catch my mind playing out this scenario of road rage
Sure.
and how I'm going to react to it.
Yeah.
What is the impact of all of those little micro stressors or micro insults on our overall health and definitely our mental well-being?
So the butterfly effect of that tiny little decision, of what could be different,
And if you think every bit of new information or experience is bouncing off of all your previous experience,
Right.
shit, you're talking about astronomical amounts of possibilities that are mostly unconsciously going through your brain, but then
Sure.
the subconscious, the unconscious will reveal information it thinks is most relevant or pertinent to your survival
Sure.
to that conscious part of you. I don't know where I'm going with that, but
I'm not sure either, but fascinated.
yeah, I don't know. Well, all in all, dude, I love you, man, and I am so glad that you are okay. I know that there is still, investigation to be done and journey to travel in terms of your actual biologic medical well-being, and then recovering from a mental health perspective from such a big event in life.
Yeah.
I don't notice any obvious difference in you. I think you've mentioned that your gas tank, like you said, it runs out a little bit earlier, but I don't notice any difficulty finding words or any difficulty expressing yourself or change drastically in your emotional state or anything like that. So
that all seems to be there. It's funny that I oddly enough I feel calmer.
Yeah.
I don't necessarily know why, unless that's some introspective subconscious thing of you went through a traumatic experience.
Yeah.
And just kind of taking your tempo.
Maybe it just destroyed your amygdala a little bit in the
be.
right place.
It could be
You
that as-
basically dirted yourself.
Yeah, I might be a superhero. Dirt myself. Honestly, like it was a struggle the first couple weeks, but I feel like I'm coming back more and more. My only real gauge of things is if I don't get enough sleep, I won't. It's like filling up a gas tank. If I don't sleep enough, I'll have a 4-hour tank that day. If I get enough, like I got enough last night, I'll have like a 12-hour tank today. Once that ends, my real telltale sign is stuttering. So the word recall doesn't come as quick. I'll start stuttering through some words. I feel it coming on right now, if I'm being honest.
Yeah.
There's been a bit of it that I can hear myself. It makes me I'm very conscious of it. I don't love that, but
Well, I stutter anyway doing these podcasts because I
I get that. But yeah, that's really the only thing. So I appreciate that. I feel like I'm progressing.
Yeah.
Yeah.
My only add-on to the recommendations would be just what I was just saying. I mean, the mind doesn't doesn't insert the positive things.
Sure.
And I really, truly believe that it is up to us consciously to make ourselves and our minds aware of any positives that may exist in any given situation. I mean, from, losing a loved one and recognizing why you even feel like shit because of that.
Right.
This stuff has to be inserted consciously. So, people talk about it, and it sounds cheesy in a lot of ways, but I think it really is important to have those gratitudes that, again, it seems silly, and I struggle to do it myself.
Sure. Yeah, I think we all do.
But when I think about it in terms of more just tipping the scales to more even, if you think about what your mind is doing,
right,
versus, what you're consciously doing, you're not faking it till you make it. You're just recognizing the things that you agree with that are actually have some benefit or some positive to it.
Yeah.
So
it's a good way to say that.
All right. Well, any final words?
Final words on this one. Stay positive. I think there's a big benefit to that. Outside of that, just be conscious of what's going on with your body. Be aware of it.
Yeah.
Yeah.
And if you lose your mind, go to the hospital.
Please do that, because it might be more serious than you think. Yeah.
Yeah, absolutely.
Yeah.
All right, bud. Well,
all right, man.
I appreciate you.
Absolutely.
Come on in here.
Trip over this wire.
I love you, man. Glad you're all right.
I appreciate it.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.